Hey, good morning, and welcome to another episode of the Fueled Life podcast. And what I want to say in the very beginning here, we are not medical doctors. We are not in the medical profession. But what we do is we go for information, go for product understanding, and what is it that's making our body that much more fueled, more powerful, and to actually live a life instead of just having years and numbers added and sitting, drooling on a couch with a little lap dog, and the poor little lap dog is getting all this drool on it. And he's like, what did I do to deserve this? So that's what our intent is in bringing this information, not just for information purposes, but to integrate, implement, and so that you can have transformation going further. And today we are talking about, a favorite topic of mine. It is the microbiome of the mouth and the oral microbiome. And when I became a brain health trainer, how important the mouth is to the brain, boom, it was blown away. Charlie, welcome, my friend. And I know you're excited about this. And when we talked about this, you were just like over the top.
Yeah, because me too, the big aha. And Stanley, we're consumers. We're consumers. We're subjected to the same marketing and the same practice of dental, what they do when you go there. And so we're not doing anything wrong, though, because we go to the dentist and they do a teeth cleaning and they do a little bit of this and maybe some blasting and some picking and scraping. And then they clean your teeth, polish them with fluoride, and then they give you a little gift bag. You're a good little patient, and you get to go home with dental floss,
Yep,
a toothbrush, and toothpaste,
right.
and maybe something else. Oh, and a little thing of mouthwash. And those items are what we're going to talk about today. We're doing the right things because that's the guidance we've gotten over all the years. And I remember, like you just said, and I'm like, wait a minute. I mean, really? So I'm excited to be here and be an awakened consumer.
That's awesome. And the thing about our podcast, and the reason that you and I decided to do this from the very beginning was we don't know what we don't know. And unless we look for it, unless we begin to investigate, become that detective. And I shared this with a doctor last week. I had a fantastic podcast last week on another podcast. And, the thing about it is that it's not the doctors so much that we have the real problem with. It's just what they're indoctrinated with, what they're taught, and they teach what they've been taught. And so it's when we question it. And I told her, I said, I'm kind of childlike in the respect of, I just want to know why. I never want to grow up, and I never want to age, and I always want to be inquisitive. And she said, you're like a detective. And that's what a child does. They become a detective, and they ask these questions because they're inquisitive. And I always want to remain that way. So, like you said, imagine you're starting your day every single day and you're brushing your teeth, you're rinsing with mouthwash. We're going to talk about that. Then you're flossing and you're doing all the right things for your health, right? Well, we're going to challenge that. Now, what if I told you that some of these habits are actually the ones that you've been taught since childhood could actually be causing some brain damage? Now, brain damage, you're not going to see it. You're not going to get a headache. Maybe you're going to get a headache. And maybe some of that brain fog is actually being contributed, the result of all these things that you've been putting in your mouth, your toothpaste, your mouthwash, the dental floss. Are they doing more harm than good? Depends on the product that you're using. And we're going to give you some alternatives throughout this podcast. So, if you're suffering with brain fog, anxiety, long-term cognitive decline, you might want to tune in. And if you know anybody else, you might want to share this video. That's one thing I want to put a plug in right now. If you love our videos, and I don't mean just like them, but love them, I want you to hit that like button, share it, leave a comment so that we know what it is that you're just desiring to find out and how we can help you have a fueled life. So, Charlie, let's get right into this. Let's talk about the oral health and how it directly relates to your brain health.
Sure. And even if you just like the video, share it. And if you don't like something or you want to challenge something we said, please put that in there too, because that's what helps us clarify and maybe learn something.
Yeah.
I'm not maybe and learn. So Stanley, my girls, when they were little, getting them to brush their teeth wasn't the easiest thing because it's boring and it's like work. But like any habit, once you do it over and over, it becomes, so it's like not a challenge anymore. Like I don't want to, they would. But that toothpaste, it was like for kids, and it was loaded with sugar.
Yep.
And it was loaded with fluoride, loaded with whatever. So it looked colorful and they liked it when it came out. And then we said, put that on your tongue. Oh, I feel like I'm eating a little candy here. I guess brushing my teeth isn't so bad. And that's okay, because the dentist said, well, what helps encourage them to brush is like a children's toothpaste. He didn't say because it's loaded with sugar and toxins that is going to, hurt your children in the long run. He was doing what he thought was right.
Right. And it's just like, they didn't know the results of mercury fillings a long time ago. And then people started going crazy and they're like, they're just crazy. No, they weren't crazy by themselves. And it was the mercury fillings. And we also understand that actually having a root canal actually causes some brain damage as well. And I've had a few of those. And I've had some.
Now I know.
Yeah, that's the problem with me. Okay. So I only have one problem and that's it.
Yeah.
Today at this moment. But we think that we're doing the right thing. And you bring up a valid point that we need to take aware of. If you read the label on the back of that toothpaste, it says, do not swallow. If swallowed, call poison control. Now, if you tell a child not to slam a door, what do? They slam the door. If you tell them not to swallow the toothpaste and it tastes good, they can't control those urges. They swallow that stuff. And we think, oh, it's just minimal. It's not enough. Well, add a little bit, add 1 grain of cyanide to your coffee and tell me what happens.
Best cup of coffee ever. It was my last one.
It's the last. And good to the last drop, you'll never know.
Yeah, Maxwell House.
Yeah. So let's get back to the oral microbiome and understand that we can be doing the right things with the wrong products. And I say the wrong products because we need to know what is on those products, what's making that dental floss slide, what's making that toothpaste taste good. And, when I was a kid, we used to get the fluoride treatment, I think, twice a year. And it'd be that blue gooey stuff, and it'd be put in that mold, and they'd crush it, and they'd say, don't swallow. And you're holding that in your mouth for 5 minutes. Well, let me tell you, it makes its way to the back of your throat.
Of course.
And you can't help but swallow it. Okay. So, if you've got bad breath, okay, there's multiple things that you can do. But doing it
Keep
with
your mouth closed.
What's that?
Nothing. I was being fresh. I said you could keep your mouth closed.
You could keep your mouth closed.
But that won't fix the problem. So go on.
Yeah. So, a lot of our bad breath comes from what we've been putting into our gut. Yep. And how our body is processing that. So there's multiple ways that we can do. So I'm going to say, before we get into it, stop the mouthwash, and I'll give you an alternative that you can do as we get into this. But here it is. It's if we know that we're causing inflammation, or you get bleeding gums. Now that creates an opening, and if we're using a product that seeps into our bloodstream, and it does. Blood's not just coming out. There's an opening, so there's stuff going in and out and in and out. Well, as that gets into your system, it may be making you feel mentally exhausted, and there's a reason for that. Now, think about that. I just dropped a bomb there, and maybe you're having brain fog, and you notice that your gums are bleeding after you're brushing them, or you're flossing them, or you're using your water pick, and they're bleeding. Now we're opening them up, and we're giving them an access. It's not just coincidence. There is science that confirms this, that oral inflammation can trigger neuroinflammation, meaning that the same bacteria in your mouth that causes gum disease can leak into your bloodstream, causing Alzheimer's, anxiety, and depression. Crazy, right?
Yeah. Well, Stanley, there's 3 critical things. We talk a lot about all sorts of fueled life areas, but for people like, oh, this is like a lot. There's 3 things: the gut, the liver, and your mouth health. I mean, if you're eating well, but using tools to maintain your teeth and your gums and all that, but they were recommended by, you thought, a good source, but they're only recommending what they know best because that's what they learn.
Right.
But you're feeling a little fog, or and this has been 25 years of using these products, and you come across a video like this and you're like, I'm a bit curious, and what can I do? Before this morning, I went on Amazon and I said toothpaste without fluoride, and 7 pages of products came up. There is no shortage of people that are aware of this.
Right.
They used to sell fluoride, and you would add it to your children's stuff, drink, because I don't remember seeing "don't drink this," but because if that was the case, our running water wouldn't be loaded with it.
Yeah.
And it is.
It is.
So, Stanley, it's again, we always say, just become curious and try it out. But let me tell you, when you try a new toothpaste that doesn't have sugar or fluoride, it's like, ew.
Yeah.
It was such a shocker for me in the beginning. I'm like, is this stuff working? Because it didn't, if it tasted bad, it was paste, it was different. But over time, then you try the old stuff and you're like, oh my God, I feel like I'm having dessert.
Right. And you bring that up. So I use a toothpaste. I use 2 different brands, and one is Boca, Boka, and I love this. It's hydroxyapatite, and what it does is it actually regrows the mineral on your teeth. It has no sodium lauryl sulfite. It has no parabens. These are neurodisruptors. It has no artificial flavors and no endocrine disruptors. So when you understand what it is that you're putting in your mouth and on your teeth, I love this brand. And this particular brand is made in the USA. Okay. Now there's another brand that I like as well. And this Boca, it comes in mint, and it also comes in this cocoa ginger. Okay. I use the cocoa ginger at night because, but I like their mint, and also this Himalaya. Now, Himalaya is made in India, and it's packaged in the US, but it also is a hydroxyapatite toothpaste. And there's no junk in it. There's no neurodisruptors. There's no endocrine disruptors. There's no SLS in it. Why are we having sodium lauryl sulfide in toothpaste? It doesn't make sense. When, we don't want to put it on our hair. Why would we put it in our mouth? And our mouth is directly correlated with our brain. So, those are 2 particular brands that I personally use. And yeah, it's a little bit more money, but let me ask you this. So this tube is like $12.99, and I get it on sale when they have it on sale at Fresh Time. And they do a vitamin sale 3 times or 4 times a year. So you get 33% off. Great deal. So I stock up on it. Now, what I want to make sure of is that I'm putting things in my mouth that are benefiting me in the long run, not just the short run. So not only am I getting this cool tasting toothpaste, this feeling in my mouth, but I'm also adding to my health.
Yeah. And your brain's not saying, what are you putting in? What are you sending me now?
Exactly.
You know? And so, Stanley, way back, dentists were different. Dr. Weston A. Price. He has he was a dentist, and he started noticing that kids were coming in with cavities like crazy. And he said, "What is going on?" And he started going into the nutrition side of everything, and he noticed that tribes, the blue zones where the people live off the earth, and they don't go to dentists, and their teeth are white. They have no cavities. They are chewing on, roots and eating, and they're healthy. They're not overweight. They're smiling. Their teeth are white. Everything's fine. And he's like, that is not what's going on here. So he started bringing to the attention that what's in our toothpaste, our mouthwashes, our dental floss, and who knows what's on those toothbrush heads, those fibers.
Exactly.
And he started publishing papers. And like recently, how if you said something that people didn't like, they'd cancel you. They canceled him back then in the 50s, 60s, and because he was bringing to the attention of the whole dentist practice that, whoa, we're doing it wrong. We got to start teaching families and kids that these things are loaded with sugar, and if you're drinking this and you're eating sweets and you're wondering why your teeth hurt, you're getting cavities, it's because, and they said, no, we're not going to let you bring that attention to anybody, because it produces, it's a cash flow. It's, the patients keep coming. If we all did exactly the right things for our teeth, dentists wouldn't need to see us that often.
Right. Right. And there's multiple things that you bring up when you talk about the bristles. Here's what I want to say. Anybody watching this, I want you to do an investigation. I want you to become a detective for just this week and go and investigate what is the material that's being used to create the bristles that are on your toothbrush. Now, you say, Stan, so what toothbrush do you use? Well, actually, I use a refillable toothbrush, and the bristles, this head, comes off, and I don't know if you can see it or not, but anyway, it is made by the company called Radius, and it is interchangeable. So I've got the handle, which is a plant-based handle, and the product itself, there's nothing toxic about that brush head, and it's a nice soft brush head. So, and it's a little bit wider than your normal toothbrushes, and by using this, now I can actually clean my gums, get in between the teeth, and not cause any irritation. And it's amazing. And, replace these every 2 to 3 months and put a new one on. So one of the things that I wanted to mention was, as I was talking about before I got off on that tangent, $12.99 for a tube of toothpaste. Now, this will last me about 2 months. And I go back and forth. So it lasts me actually longer than 2 months because I use this at night and I use the mint in the morning. So for those of you that have ever been to, let's just say, anything with golden arches, and you get a sandwich that costs $8 and it disposes the next day if you're healthy. That's $8 that you put in and disposed of, and you didn't really get any nourishment out of it. What if you took that same $8 and invested it in something that's going to actually give you health, actually going to produce the results in your mouth that you want? That's just my plug. I'm not an affiliate, but I'm going to call the company and see what I can do about that.
And you're definitely not affiliate for the Golden Arches.
That's right.
I know that. Okay, so we know now that maybe to become curious about toothpaste, look at it, I mean, who cares? Colgate, Crest, Aim, all those. Just take a look. And I think Yucca, I think they do
Yep.
toothpaste.
Yep, they do.
Yeah. YUKA, the app we always talk about.
Yep.
And just take a look at it. Try that up because it's going to be less sugar. And like you said, Stanley, it's going to be healthier for the gum, the teeth, in between the teeth and your mouth, your bacteria that's in your mouth. And so then you move on to, what else? I mean, I don't personally use mouthwash, but I remember like trying Scope and I think, no, it was one that I put in my mouth and it made my eyes water. Like,
Listerine.
yeah, it was the most powerful. And I'm like, oh God, why would anybody do this? And then of course, it just wrecked everything.
Right.
Like you said, it wipes out the bad bacteria, but it wipes out the good bacteria.
Yeah. It's an
and then your mouth is like, it's shocked.
Yeah.
And that stuff. I mean, yeah, it has alcohol in it, and it has it probably, if you put it on a rag, it would remove the paint on your house.
Yeah. Well, and that's it, Charlie. It's an antibacterial. So the thing about the mouthwashes that are antibacterial, it doesn't have the capacity to decipher, oh, this is bad bacteria, this is good bacteria. It just kills it all. We need the bacteria that's in our mouth, the good bacteria, which gives us the microbiome in our gut. So if you're killing all things, you're destroying the life of what's living, and you're getting rid of what's bad, but it can't decipher between the two. There is not a smart mouthwash. And, if it's Listerine, kills bad breath. Well, it kills bad breath because it sets your mouth on fire.
Yeah.
I mean, just not a good thing. And what it does is it destroys the nitric oxide buildup in your body. Nitric oxide expands the cardiovascular system. And when your cardiovascular system starts to compress and plaque grows, those red blood cells cannot make it through your cardiovascular system. And this is what causes blockages. And the majority of our cardiovascular system is the capillaries. Now, I don't want to get too academic on it, but I will tell you that some of your capillaries are 4 micrometers in diameter. A red blood cell is 7 micrometers in diameter. For it to be able to get through, there's a lining inside, and it's the endothelial lining inside the blood system, inside your cardiovascular. When that starts to get broken down, those red blood cells can't get through. And that is when nitric oxide production has been diminished until now you've got a problem. And, we know that cardiovascular deaths are, I think, the 3rd leading cause of all deaths across the world.
Yeah. And there's many factors that do that, but here's one.
Yeah.
And so I always, take a look at it. Take a look at what you're doing. And if you're using ACT, or I know there's names, who cares? Because if you go on Amazon and type in a healthy mouth or whatever, or do a little research, you're going to find products. They're already there. There's companies that are fully in making healthy products that aren't affecting us. And, so Stanley, but who gives us mouthwash for free in our little bags? Hotels?
Yeah, I don't. Yeah, because if it's free, there's a big red flag. So when you go to the hotel, don't pack your bag with all the mouthwash things that you can carry out of there, even if it tastes good, because if it's free, there's a reason that it's free. Now, what can you do as an alternative? Okay, here again, I love the company Boca. Okay, they make this thing called a tongue scraper. So you scrape the bad bacteria off your tongue. It reaches all the way back and you scrape forward, you rinse it, you reach back, you scrape forward. You do that 3 times. You're taking that junk off that your body has kind of got rid of as you're sleeping through the night, and it kind of collects on your tongue. And, you definitely don't want to be doing that kissing the first thing in the morning, unless you're on a honeymoon. Then you're just, anyway. So you scrape it and then brush your tongue with some Boca or Himalayan toothpaste and watch what difference it makes in your mouth. That's my alternative. That's my suggestion.
Yeah. And I haven't had a cavity in many years. Many years. I have problems in my teeth from the past of not using the right products, eating sugary foods, and going to bed without brushing my teeth, and doing the wrong things. But I never learned any of that through the place you go for your teeth. No one ever said. I said to my dentist at one of my visits, I said, "Why do you give me this care package? I don't take it, but." And he's like, "Well, it's just, obviously the companies are giving it to him for free to promote their products."
Right.
And I said, "Do you realize?" And, I don't want to be harsh because the guy does good work and all that, but I mean, that's what he knows. And it's like, well, and if he tried to change his practice and talked all about that, and then all of a sudden his patients didn't really need him anymore, not as much, but anyway. And when I learned about the mouthwash, I mean, just using it was a telltale,
Mm-hmm.
like, whoa. I mean, I have it's like, putting Jägermeister in, and that stuff burns too. And then we go in water, Stanley. I have a Berkey filter, right? A Berkey is a water filter. It's got 4 filters in it, big filters. 2 of them are to remove the fluoride from the water, and the other 2 are all the other. And you fill up the tank and it drips and it goes through 4 filtering systems, but 2 of them, 2 big white canisters, are to remove the fluoride in the drinking water. And when I fill that thing and I sniff it, it smells like my pool,
Yeah.
fluoride. And it's like, no. And I didn't know that. I mean, they're making it come out of your faucets. How could it be bad? I remember telling my dad. He's like, "Well, yeah, I drink the water out of the faucet." Oh, yeah. He's like, "Well, that's ridiculous. They wouldn't put bad water into our homes."
Exactly. Yeah. And we got a comment that Joan has switched to Boca. Congratulations, Joan. And she uses Scope mouthwash occasionally. And Yucca rates it at 79 out of 100.
Nice.
Again, it is here's somebody has taken this Yucca app, and she said, "Hey, I want to know what I'm putting in my mouth. I want to know what I'm putting on my body. I want to know what I'm lathering up with." So congratulations. And yeah, 79 out of 100, that's fantastic. What are the other 21 points that are missing? And is there something that even taking it 1% more better or different next month? And this is where becoming a detective, as Joan has become, and saying, "Hey, you know what? I want to know what it is that I'm putting into my body or putting on my body," and making an educated decision so that, hey, we can have a fueled life. That's the biggest value of this whole podcast.
Yeah, to have a fueled mouth.
Exactly. And not have it be on fire.
So, Stanley, then the next thing we do is something I didn't do, until I was going to the dentist. I didn't floss much because, that was the most boring thing. And, it slowed me down. So I didn't. And I did once in a blue moon if something was caught or something. But since I've learned how impactful getting all that out.
Yep.
And keeping your mouth clean keeps your brain cleaner, keeps your gut cleaner, keeps your liver cleaner. It's amazing. And so now I love flossing. And but what are they coated with? Like frying pans?
Yeah. Yeah. So when you're looking at your dental floss, what makes it slide through is this wax, and these coatings have forever chemicals in them. Now, this is not Stan or Charlie making this stuff up.
No.
Do a research and find out what we have been taking for granted for so long, and you can be doing the right thing, but doing it with the wrong product. It's kind of like using a butter knife as a screwdriver. It'll work, but it's not going to work very long at the dinner table, especially if you get one of those, really stuck screws and you twist that thing. It's just not going to work very well. So when you understand that there's forever chemicals, these non-stick, flosses that don't go in as easy, well, they're causing hormone disruption, cognitive impairment, and immunity dysfunction. Because if you've ever flossed your teeth and you break through the gum, guess what? You've opened up the blood barrier opening, and those chemicals, they seep into your system. Now, I know that may be infuriating to some, but know what the product is that you're putting between your teeth, because it's the same product that they're putting on nonstick pans, on waterproofing clothing. This is the product that they're putting on the dental floss. Now you're going to say, Stan, what option do I have? Well, hey, I don't bring you theory. Okay. This ain't about theory. This is about practical application. I'm only going to share with you what I do. And once you make that decision to investigate, you can make better decisions. Okay, here again, this is made by the Humble Company, and it is a plant-based. There's no junk on the string, on the floss, and you should be flossing your teeth at least once a day. It's simple. They made it easy. There's 50 disposable plant-based products that, hey, I carry them with me everywhere. I'm not going to use Glide. I'm not going to use things that are made by the companies that have the junk on it. If you're buying a pack of 800 for $3, you are wasting your life, not just your money. You're wasting your life, because you don't realize that convenience, because it's $3 versus, I don't know what this is, $5, $4, $4.50. Here again, your cheapest products are your most expensive. And the most valuable thing you have is your life. I'm sorry, I'm not as passionate or excited about this podcast as I normally am.
Yeah, I can't tell.
Right.
I mean, the fact that you have your arsenal with you is awesome.
100%, man.
But what you're saying, Stanley, is first of all, we get like disrupted and shocked and like, what? And then it's like, oh God, now I got to figure this out. Gosh, I just learned that my bagel in the morning isn't serving me and sour cream isn't. And, the wrong peanut butter on it and all that. And I'm like, oh my gosh, now I got to figure out a way to eat healthier. And, and it's like, it's so overwhelming and confusing. But you just showed it's very simple.
Yeah.
Well, I mean, it's a little search. It's a click. And you can get it shipped to your house and, start trying or not. I mean, that's also, I wouldn't walk in to your next dentist appointment and punch them. Like, what are you doing to me?
Right.
In my old business, Stanley, we helped people with failing eyesight, macular degeneration, all different eye diseases. And they would come from the retina specialist. Or an ophthalmologist, right? Who just diagnosed them. Or they could have diagnosed them 2 years ago. And they would come in and I asked every single person, how did you hear about us? And they would say, my neighbor, this, that, and the other thing. I said, do you have a retina specialist? Yes. And they didn't tell you about us because, of course, I outreached and said, hey, when you make the difficult diagnosis, and you can't fix the eye disease, you can help manage, maintain, and do things, send them all over to me. I will help improve their independence and quality of life through adaptive technologies. And some started to, but so I had this really heavy duty flyer, threefold, and it, it was almost a weapon. And I would tell the person, when's your next doctor's appointment? Oh, it's, next month. And I'd say, you take this flyer in, and when he comes up to talk to you, you hit him over the head with it.
Right.
And you say, why didn't you tell me about this? And it worked like crazy. They would go, and then the doctor would go, okay, that's great. They did all that for you. And that is, what I'm not saying, don't go in with your big old king size, oversized tube of tooth crest and hit your doctor over the head. But I raised awareness in the doctors. I had the patient go in and say, hey, I wish you had done this for me. And that's what we do. We're trying to raise curiosity and awareness, because you're not going to get it at the dentist. Not now. Maybe there are, and I don't even know, Stanley, are there holistic dentists out there?
There are, and they're sprouting up more and more and more and more, because they have broken away from the system. And this is, the interview that I had last week with a doctor who was in the system. She was, she was a top doctor in her facility, and she just noticed that people weren't getting better, and they were giving a prescription that wasn't really addressing the cause. And she focuses on thyroid health. And if you haven't seen that, go to my channel and check that out. It is just phenomenal. And I love these doctors. I love these doctors that are saying, you know what, enough is enough. I didn't know what I didn't know. They're human beings, okay? They're just sharing what they've learned. And until they expand and learn even more and investigate, when, we typically don't investigate if something's not broke. If it's not broke, we don't fix it until we discover that it's been breaking all along. And that's what I love about the holistic approach to dentistry, to medical attention, to, one of the things that I do is a holistic approach to becoming pain-free. It's just not drugs. It's not surgery. It's about getting your body in alignment. And one of the comments that we just had from Jennifer was, this is scary stuff. Well, what we want to bring is, we don't intend to scare anybody, but to bring an awareness so that you are better equipped to make an informed decision. And that's what this is about. And we don't know what we don't know until we find out that, hey, I don't know crazy. I don't know karate, but I do know crazy. If I'm working with somebody, if I'm in a relationship with somebody that's crazy, I just got to get out. If there is a disconnect in my body somewhere and things aren't lining up, I have to ask the question, what is it that I've been bringing into my body? What is the exposure that I've been connected to that could be contributing factor to feeling as I do, and make the shift, make the changes?
Yeah. You are very passionate about this. I love it.
I am.
And that's the deal. It's taking charge. You want a fueled life. No one's going to show up at your door and offer that to you. A fueled life is never on sale. It takes work. It takes discipline, and it takes hanging out with people that also want to have a fueled life. And that's what I do, because we could drift back to, oh, it's just easier. It's less money. It's whatever. It's not going to kill me. Well, maybe not overnight, but it's certainly not going to help in your later years of life. Yeah. And that's what it was, very scary. And I was pissed when I learned this stuff. Like, what? That's ridiculous. And it's like shocking. I remember telling Molly, my wife, saying, this stuff is crap. I just cut right to the chase.
Right.
And I don't even know everything about it, but I do know scientifically the chemicals in this toothpaste, what it does in the long term. And I'm not willing to do that anymore. you
Right.
know, and the switch doesn't just, I didn't magically transform nothing, it's like going to the gym, the first, I didn't say, yeah, I'm done. This is a lifelong practice that you
Right.
switch over to, one step at a time, one product at a time, and it's going to take getting used to. I think the easiest thing would be the floss. That, you still got to floss. So what if you got to spray a little WD-40 on it? I'm only kidding.
Yeah. 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 So there's two things that I wanted to mention before we bring this to a close. Number one, ditch the fluoride. Okay. Don't wait till the toothpaste is empty. Squeeze it out into the trash so that you're not tempted to reach in the trash and say, I'll just use this till the end. Just ditch it. If you've got mouthwash, go run the app on it. If it's not good, if it's alcohol based and if it's antibacterial, ditch it, pour it down the drain. Let it clean the pipes. Okay. It'll clean the drains.
Drano.
Exactly. And if you've got that dental floss that's in that little reel, and it is made by some of the major companies, it's got PFAS on it. It's got forever chemicals. That stuff is going to do more damage than it's worth keeping. Throw it away. It's better not to put that crap in your mouth than to use it until it's done. Get rid of it. Okay. We can find a way to replace it. Get a product that's healthy for you, and you can do the tongue scraping. It's a little different in the beginning because, you get that gag reflex, but you get used to that. And then your tongue gets used to it, and you just scrape it down and rinse it off and scrape it down 3 times and then rinse your mouth out. And you're not getting rid of the good bacteria. You're just getting rid of the junk that's on the top. And then, the other thing that you can do is oil pulling. And there's so many benefits behind oil pulling. You take coconut oil and you melt it down and you put it in your mouth and you swish it. And you swish it for about 5 minutes. Now, you want to do this outside. Do not do this in your sink, okay? Because coconut oil, when it solidifies, okay? And then it gets cold, it solidifies. So if you start spitting this down your drain, you're going to have a plumber come out and you're going to be cussing at me, sending me all these nasty e-grams. I'm telling you in advance, go spit this stuff out in your garden, in your yard, and then it does no harm, no damage to anything. Swish it around for about 5 minutes, and it's amazing the healing that coconut oil pulling does. You're not pulling it. It's just you're swishing it around. And it takes a little bit to get used to. Just take a little bit, swish it around, and check it out. It's going to feel a little weird at first, but the health benefits, man, it's unbelievable what it can do for the oral health. And oral health is so directly related to the brain health. I can't stress that enough. Mm-hmm. So, Charlie, is there anything? I mean, man, we could probably go on for another hour on this.
No, because then we'll be just going off course too much. And I certainly got reinvigorated to continue to stay on the right path and continue to stay curious and ask questions. Yeah, ask questions. And then, Stanley, we all know our bodies are extremely complex systems.
Yes.
But in any system, whether it's a manufacturing, whether it's anything, each process moving through the system gives a result. And our cells, the microbiome, our bacteria, the blood flow, everything is working together.
Exactly.
And when you're, partway through the system, have a little yuck. And then, oops, I ate something bad, or I'm doing the wrong thing in my mouth, or I'm drinking the wrong, so we're disrupting that. And the body says, let me see what I can do to filter that. I see, we're not perfect, but we can get cleaner, healthier, and our systems in our body, our cells, our microbiome, our metabolic. I mean, it's amazing how it starts stacking up. Yesterday, I turned 58 years young.
Happy birthday.
And that's That's great. I mean, I remember being, people are teasing me, oh, you're getting old. I'm like, nah, I feel great.
Right. Yeah. Well, that's a great way to close. It's not about adding years to your life. It's about adding life to your years. There is no value in sitting in a position that you cannot move, and you are so ridden with pills that you're adding all of these outside elements. Take the control now while you have the opportunity to make a 1% shift and have a fueled life. Until we meet next week, I want to say be outstanding and have an outstanding fueled life. We'll see you then.